This recording will go over nutrition standards as well as nutrition assessment. Current focuses on nutrition are targeted toward health promotion and the prevention of disease by healthy eating and exercise. Dietary reference intakes serve as nutrition guides to provide a scientific basis for food guidelines in the U.S. Dietary guidelines for Americans include follow a healthy eating pattern across the lifespan, focus on variety, nutrient density, and amount, limit calories from added sugars and saturated fats and reduce sodium intake, shift to healthier food and beverage choices, support healthy eating patterns for all. To remind adults about healthy eating habits, the USDA designed MyPlate, a picture to demonstrate that half of each meal should consist of fruits and vegetables. When grains are consumed, half of them should be whole grains rather than refined grains. Some adults follow vegetarian diet patterns for health, environmental, or moral reasons. In general, vegetarians are leaner than those who consume meat. The lacto-vegetarian eats milk, cheese, and dairy foods, but avoids meat, fish, poultry, and eggs. The lacto-ovo-vegetarian includes eggs in his or her diet. The vegan eats only foods of plant origin. Some adults among these groups eat fish as well. Vegans can develop anemia as a result of a vitamin B12 deficiency. Therefore, they should include a daily source of vitamin B12 in their diets, such as a fortified breakfast cereal, fortified soy beverage, or meat substitutes. All vegetarians should ensure they are getting adequate amounts of calcium, iron, zinc, and vitamins D and B12. Nutrition status reflects the balance between nutrient requirements and intake. Common factors that affect these requirements include age, gender, disease, infection, and psychological stress. Evaluation of nutrition status is an important part of total patient assessment and includes review of the nutrition history, food and fluid intake record, lab data, food and drug interactions, health history and physical assessment, anthropometric measurements, and psychosocial assessment. Monitor the nutrition status of a patient during hospitalization as an important part of your initial assessment. Collaborate with the interdisciplinary health care team to identify patients at risk for nutrition problems. An initial screening provides an inexpensive, quick way of determining which patients need more extensive nutrition assessment by the healthcare team. The Joint Commission Patient Care Standards require that a nutrition screening occur within 24 hours of a patient's hospital admission. If indicated, an in-depth nutrition assessment should be performed. The initial nutrition screening includes inspection, measured height and weight, weight history, usual eating habits, ability to chew and swallow, and any recent changes in appetite or food intake. The mini nutritional assessment is a two-part tool that has been tested worldwide, and it provides a reliable, rapid assessment for the patients in the community and in any healthcare setting. The first part is a screening section that takes 3 minutes to complete and asks about food intake, mobility, and BMI. It also screens for weight loss, acute illness, and psychological health problems. If the patient scores a set number, I'm not worried about you knowing the number, a second part is completed with an additional 12 questions. The entire assessment takes only minutes to complete. The MNA short form can be used as a standalone tool to evaluate whether the older patient is well nourished, at risk for malnutrition, or malnourished. The alternative is to take the patient's calf circumference, which can be a reliable alternative if BMI is unavailable. Anthropometric measurements are non-invasive methods of evaluating nutrition status. These measurements include height and weight and assessment of BMI. Obtain a current height and weight to provide a baseline. Be sure to obtain accurate measurements because patients tend to overestimate height and underestimate weight. Measurements taken days or weeks later may indicate an early change in nutrition status. You may delegate this activity to unlicensed assistive personnel under your supervision. Patients should be measured and weighed while wearing minimal clothing and no shoes. For patients who cannot stand or those who cannot stand erect, use a sliding blade knee height caliper if available. This device uses the distance between the patient's patella and heel to estimate height. It is especially useful for patients who have knee or hip contractures. If a bed scale is used to obtain the patient's weight, document in the EHR the number of sheets, pillows, and blankets that were on the bed during the baseline measurement. The patient should be wearing the same clothing and have the same bedding on the bed from day to day thereafter to ensure accurate measurement. For daily or sequential weights, obtain the weight at the same time each day, if possible, preferably before breakfast. Conditions such as congestive heart failure and renal disease cause weight gain. Dehydration and conditions such as cancer cause weight loss. Weight is the most reliable indicator of fluid gain or loss, so accurate weights are essential. An unintentional weight loss of 10% over a 6-month period at any time significantly affects nutrition status and should be evaluated. Depending on the patient's needs, weights may need to be taken daily, several times a week, or weekly for monitoring status and the effectiveness of nutrition support. In the healthcare setting, assessment of body fat is usually calculated by the dietitian. The body mass index, or BMI, is a measure of nutrition status that does not depend on frame size. It indirectly estimates total fat stores within the body by the relationship of weight to height. Therefore, an accurate height is as important as accurate weight. BMI can also be determined using a table. So there's different ways to determine it. You can look at those on your own there. The numbers that I want you to know are these here. So the least risk for malnutrition associated with scores between 8.5 to 25 BMI. So BMI is considered normal if it's between 8.5 to 25. Body weight and BMI usually increases through adulthood until about 60 years of age. As adults get older, they often become less hungry and eat less, even if they are healthy. Ideally, older adults should have a BMI between 23 and 27. The average daily energy intake expended by this group tends to be more than the average energy intake. Their physiologic changes has been called the anorexia of aging. Many older adults are underweight, leading to undernutrition and increased risk for illness. Skin fold measurements estimate body fat and can be measured by either the nurse or the dietitian. The triceps and subscapular skin folds are most commonly measured with a special caliper. Both are compared with standard measurements and recorded as percentiles. The mid-arm circumference and calf circumference can be obtained to measure muscle mass and subcutaneous fat. These measurements are needed if the mini nutritional assessment tool is used.